Pfizer was forced to release they were forced to release their internal documents. I was shocked that they released this. This is from their research and development headquarters in Groton, Connecticut, called the Structural and Biophysical Characterization of SARS-CoV-2 Spike Protein. So this is from their R&D department. It explains how the spike protein was and is created. So it's created this way, and it's specific to what it says. It's both the structural as well as the biophysical or biotechnology components of it. So this explains what is in the shots, the main component, which is the spike protein. And the spike protein is delivered as a payload. So, and then it can hijack human cells. So it's actually a very alarming document. If you go on to the next slide. Okay, so now this, what this explains is that this is the introduction. To the left-hand side, I just put the original patent that's owned by Barney Graham and Andy Ward and Jason McClellan, who work for universities and NIH. But to the right is the document, and it clearly explains that in this Pfizer research and development document, that the glycoprotein that's in the vaccine candidate, which is BNT162b, includes the 2 amino acid substitutions. They call it the P2S substitution. So the spike protein that's owned by the NIH and Moderna and some universities is called the S2P, and Pfizer called theirs the P2S. They basically stole this intellectual property, and they're refusing to pay Moderna for the royalties and the government. It's funny, but it's not funny. So anyway, that's what this is. It's to create the spike protein that's in BNT162b, as well as what's in Comirnaty. Okay, and this is where it's alarming, is that they use electron microscopy. So it's creating electromagnetic fields and using different substances to freeze these biosynthetic structures at subarctic levels. But what this explains is what they did. They order the mRNA, which are genetic codes. They infect human embryonic kidney cells, HEK cells, and then those human embryonic kidney cells produce new chimeric proteins, so that are part human, part non-human genetic material. And then they overlay that, so it's 0.5 milligrams per milliliter, to what's called gold quantifoil, which is made of gold nanoparticles, and then graphene oxide, which is a single atom thick graphene oxide layer. And then there's an electromagnetic field that's created. So when that's being done on through this electron microscopy process, let me know if you can see that next slide. Can you see that? So when that's being done during the process, there's actually molecular binding of the inorganic material, so the gold nanoparticles and the graphene oxide, with the organic proteins that are part human and part non-human. So they create a new life form. It's a new species. It's actually at the molecular level, they're creating the binding of non-human DNA from other species and human DNA with inorganic material. So Pfizer published this process as well through the NIH PubMed database. I did a search for it, and it's called Application in Cryo-Electron Microscopy in Small Molecule and Biologics Drug Design. So this is the publication where they're talking about how they use cryo-electron microscopy to take metals, inorganic materials, and merge them at the molecular level. It's called molecular coupling, to create new, they call them drug therapies, but they're not drug therapies. You're taking genetic material, RNA and DNA, that was inert, not alive, and bringing it to life, right? And now it's a pathogen that has parasitic properties because it penetrates cells and then produces non-human and a part non-biological materials inside the human body. So this document goes through that a bit. So it's, again, this document is published on NIH, the PubMed website. in 2021. The authors are the research and development folks from the Groton facility, Joshua Lees, Gal Diaz, and Sengol Han, if I'm saying that right. You can see right there, it's from the Pfizer Worldwide Research and Development from Groton, Connecticut. And it says clearly, in this review, we discuss recent instructive examples of impacts using cryo-electron microscopy in therapeutic design. So it is the biophysical properties using cryo-electron microscopy to create these technologies. It is the creation process. It is the manufacturing process. Now, they may be able to use transmission electron microscopy for larger scale production, but this is essentially this is how they are creating what they're calling new drugs, which are new mRNA pathogens. It's done using cryo-electron microscopy.
I saw a lot of interviews with Francis Ale Boyle, the international professor in international law, and he said early, this is not a virus, this is a weapon. And he had also called those so-called vaccines, the mRNA injections, Frankenshots. Just to be clear, from the beginning, this was not a virus, it was a weapon produced inside a Bio4 lab. And this is nanotech, not a virus. It's not a living human virus. It's biotech weapon from the beginning.
Yes, yeah. And again, Lieutenant General Kiryov from the Russian bioweapons and nuclear program has said that these are they're artificial viruses. They're artificial pathogens, meaning that they're AI. They're artificial intelligent pathogens.
We have to be real clear here so everyone understand. This is very important, Karen, and even you who is watching. Remember, from the beginning, there was no virus. It was a bioweapon, as they called a virus, to frighten people. And the injection who should save the people, as they called vaccines, is a bioweapon. To be real clear, is that the truth? So no one can misunderstand this, Karen.
Yes, that's the truth, and that is the evidence that, again, I don't know if people understand this. Russia is one of the top 3 global military powers. That is what they're using to begin criminal prosecutions against Pfizer and nations that are engaging in this. And they just partnered with China. I do not know what the future of our globe and sovereign nations is going to look like. But I do recommend that if you have ears to hear and eyes to see, that you do what you can in your community and in your nation to remove these bioweapon injections from your communities, to stop aerosol attacks from your communities, to stop food contamination attacks from your communities, to do what you need to do to get on the right side of history and the right side of God, because judgment's coming. Whether, running from this demonic plan to inoculate humans with artificial intelligent pathogens doesn't make it go away. It's not. It's just, what side of history are you going to be on? And more importantly, when the judgment comes, and eventually the final judgment is in front of God, did you do the right thing? Did you stand in truth? Did you protect yourself, your family, and your community? Or did you participate actively or passively in this plan to harm and destroy humanity?
This is very important, Karen, because you have 2 sides of this coin, as normal. The truth, the fact, and the proofs, as you represent, and you have the competence to talk about, and you have also shown it. So even the Russian specialists are referring to you, Karen, and your Karen Kingston report. That's amazing. But your own country and your own government don't take it up and protect you and your foundings, your proof, your facts, and your evidence. That's correct.
That's correct, because I am considered dangerous and not credible by the leaders from America.
Where do they have the proof? Just talking, or can they give you any proof that they have the right to decide that about you?
They have they're the inventors of mRNA technology. They're researchers with 25 years experience, so their opinion is more important than facts and evidence. This would never, I worked for big pharma and companies, and when we had med legal review meetings, if someone came in and threw a temper tantrum saying, I'm Dr. So and so, and I'm not going to look at the documents that Karen brought in, and throw a temper tantrum, they got a call from their boss's boss's boss and says, your opinion and your ego needs to walk out that door before you get us in, fined and in trouble or a product pulled off the market. So it's not atypical for humans to act this way, but it's atypical that that even Congress is saying, no, we don't want facts and evidence. We want to sit around and listen to experts opine in a hearing.
That's very
That's
important.
what you do.
That's very important, Karen, because of course all of them are in the situation of a bias. It's money. Just follow the money, because the important thing is about those companies and those government who's working together in this fascism. They are in the same boat, of course, because we have the situation to know about DOD is involved in this Department of Defense in USA. Is that correct?
Yeah, the contracts was done under the Department of Defense. The research is done under the Department Threat Reduction Agency and BARDA. So again, and there's documentation, unfortunately, with the U.S. government's name on it, where this actual vaccine technology, they call it vaccine technology, is for use to deliver agents of biowarfare. So what's sad is that I had much of this information I sent out in May of 2021 to members of Congress and governors and influencers and doctors. And it was dismissed. And if people had looked at facts and evidence instead of being manipulated by experts, which they've been manipulated by,
or bought,
or both. But then I believe America could have done an about face, right? I think we could have gotten the truth out there, but we were told, no, this is too much. The mRNA is not bad. It's not good for children, but it's good for these people. And those were all just lies. That was gaslighting. And so it's sad that my med legal analysis has been ignored by leaders who are allegedly trying to protect our rights in America and by our government. And it's being used by global Russian military leaders. I'm saddened by this. I don't. We are in the middle of World War III. I'm not expecting to get a medal. I mean, I'm expecting, hopefully, if this goes the way it's looking, that I get a peaceful execution. I mean, this is not good. And I don't understand why in America, people refuse to look at facts and evidence. That I've gone through thousands and thousands of pages that would stand up in a court of law, and apparently they're standing up in military courts of law. And they refuse to look at them. Or they say the words don't mean what they mean. I mean, the FDA approval happened. The contract between Pfizer and the United States government says Pfizer acted independently of the United States government. That's what the contract says. So there is a chance for America to have some salvation and immunity, because Pfizer says we're going to do this on our own. The US government says you own the intellectual property. We don't own it. And it also says you're going to make sure the product is safe and effective according to FDA guidance. So they broke all the laws. They released a bioweapon on the global population. And our leaders want to defend Pfizer and throw the entire United States government under the bus. I don't understand it.
It's very simple. It's very simple. I will tell you about why, as my opinion, Karen. In Sweden, during the 40s, they started to make those electron up in the brain on people, and they didn't take in any form of informed consent. They did it in secret. So probably Sweden is the nation of the leading on this, because they couldn't do it in the US, so they moved it over to Sweden. And we have done interviews about that before. And this is truth by facts. We have seen the documents. It has been written on New York Times and shit like that. A lot of people in this world are brainwashed by this technique. That's for sure. Because this is not humans. This is sociopaths and psychopaths, and they are probably also stupid because they have no control of their own thinking, probably. And then we go into those things we were discussing with the slides. The graphene is it's a poison. We know the spike proteins is a poison. It's a bioweapon inside, a fabric inside every human who got this, if they got the right batch, because how bad is your batch is something everyone can check up. We have we have another situation too, and that's very important. The connection between this technology and 5G and graphene. Please take us in that area, Karen.
Well, I don't have a full presentation on the 5G and spike protein that I can pull up right now, but if we go back to the other slides, I can finish a little bit about this graphene oxide, and I can just speak to the research. So when you guys can see the slides, let me know. You can just pull them back up. They're back up on the screen. Okay.
There we have them on the screen. Please continue.
Yeah. So again, I just say it's important is to look at the title, which is the application of cryo-electron microscopy in small molecule and biological design. So it's for the design of the spike protein that's in the Pfizer injections. That's the payload, and it says right here that the focus is largely on the implementation of this technology to merge inorganic material with human DNA and other non-mammal DNA, and it's the implementation at Pfizer. So this is what Pfizer is doing. If you go on to the next slide, which I'll pull up, this is what's important, because we want to understand what's going on with people's, why is this attacking their reproductive system, their neurological system, their ability to think? Why is it attacking their gastrointestinal system, the lining of their blood cells, the circulatory cardiovascular system? So what this stands for is guanine, which is one of the nucleotides for DNA, which binds with a lot of different materials. It's a friendly genetic nucleotide, if you will. So guanine proteins coupling receptors. So what it says is that these proteins, like they're preparing them to bind with other genetic sequences from a large druggable membrane protein targets with over 800 members in humans. So what's important is they talk about what they're looking to do with these injections is have them bind to the membranes throughout our body. So like, for example, our nerve cells and our brain cells, they have like the myelin sheath. So this is binding with that and destroying it, and then creating, either that's why people are having some of these strokes and blood clots, neurological dysfunction, and brain fog. But it's eating away at the protective layer of our nerve cells and our brain cells. That's what it's doing. And the idea is that it'll create a new biosynthetic coating and also possibly new biosynthetic nerve cells throughout our body. So that's what this technology is doing. It's actually going in and creating hybridization of cells through a technology called a dendrimer. And I just don't have that to show you right now. But so it through the process of apoptosis, but that's natural cell death. It's an accelerated cell death to create a new hybrid cell, and it penetrates the membranes of the cell. So it's going throughout. That's why you're seeing those biosynthetic clots that and died suddenly. Those are the product of this technology, which is a aggressive artificial intelligent pathogen that is part biological and part technology. And it's designed to go and target the membranes throughout our bodies. So it's a very intelligently designed weapon. James Clapper, who served under the Clinton administration in the intelligence community, said this technology is a bigger threat to humanity than nuclear war. So again, they just say that they've created over 150 of these pathogens already in the last 5 years, and I believe this is specific to Pfizer. I'm not exactly sure. And over 400 known genes in humans. So the concept is once you do the mRNA technology, this mRNA pathogen, which is AI pathogen, you start to do the experimentation inside the cells, inside the animal, inside the human, inside the animal to become a production factory. And I have that in another presentation. And then just so people understand, this is it's known. What's interesting is so mRNA, which is the concept of creating these new genetic codes, these new genetic proteins that have life, they're completely unstable. Sunlight kills it, air kills it. They even talk about trying to look at them under a microscope. They can't even do that because they disintegrate when they come in contact with air or fluid or light or anything. So that's why this cryo-electron microscopy method is so important. It is that overlay of another material. And this is specifically, this is graphene oxide or gold or silver or titanium or whatever. That then quickly, like in nanoseconds, captures that protein and the shape of it. And through that electromagnetic field, I mean, they're literally creating new atomic bonds, new ionic bonds is what they are. So they're creating life forms. As you go through these topics, they even talk about the ability to, through the ionic bonds and the electrons, to achieve the superposition, which is quantum mechanics, which is how life is created, right? I mean, it's really crazy stuff, but they, through trial and error and these very advanced technologies, creating electromagnetic fields, they were able to create these new life forms that merge inorganic material with organic material. And so this is well established, but I just want to be clear that this paper, which talks about the use of graphene oxide, that this is not absorption. It's not that it adheres to the outside of the cell. This is not a coating. It's actually a new molecular bond is what they've done at Pfizer. Does that make sense at all? Or no? The graphene oxide is part of this living molecule now. It's not just a coating.
Can I ask something here? Break in here. How sure is it that we have a lot of graphene oxide? Because in Sweden, some people are 100% sure, and some people are 100% sure there are no graphene oxide. But for me, it seems like there's a lot of graphene oxide. Do you have the answer?
Well, it's not a matter of quantity. I don't know what the quantity, because this is all at the nano size, right? This is all, but Pfizer's document says it contains graphene oxide, and then people say the document doesn't say that. I'm like, literally structural biological drug design. They're saying they use cryo-electron microscopy to do a molecular bond of the graphene oxide to the spike protein. That's what the documents say. I'm sorry, people don't understand them. Documents, but I mean, I think if they read these documents and the other couple dozen documents I've read on the use of cryo-electron microscopy in structural biological drug design as the new method for developing these AI pathogens, they would understand that. So it is in there. So I think what the challenge is because, like, under the FDA, if a product is trace amount, so we're talking about a nano-sized molecule, a nanometer is 1/1000th the size of a meter. The FDA just said we're not going to. We don't really know how much we need to monitor the use of nanotechnology, and if it's at such a small level, which is a fraction of the size of even a virus, then although this is known as a virus, the spike protein is known as a virus material. The SARS-CoV-2 virus, I think I saw someone said it was 160 nanometers, and the FDA is saying, well, we don't. We're just not going to give any recognition to it. But that's actually the most ridiculous thing I've ever heard, because this 160 nanometer size spike protein is the bioweapon that caused the global population to shut down. So to say that you don't need to disclose that it's in these vials and contains graphene oxide that's hypocritical, because you're shutting down a nation based on nano-sized materials, but then you're not disclosing to the nation that they're being injected with nano-sized materials.
Okay.
Does that make sense? Or I don't know how much more validation. Do you want to look at the document again? I mean, this is, I'll pull it up again if you want to take a look. This is the process of of using graphene oxide to create new ionic molecular bonds. It's called molecular coupling with the biological RNA and DNA that is produced from human embryonic kidney cells, and they're calling that the spike protein.
A question here. How do you think, like, is this a never-ending story? Because if this spike protein can jump from one person to another person, it seems like it might be a never-ending story. And if it's a never-ending story, then we are in deep shit, I think.
Well, I can go to other slides that explain that Pfizer says they're going to turn your body into drug medicine factories. Well, this is their drug medicine. It's this bioweapon, and it's an aggressive pathogen. It is infectious. I mean, it's infectious with inside a human body, and then it can be transmitted. So the question is this a never-ending story? The answer to that is I don't believe it is. I think if we don't stop it now, there is a point of no return. I don't know what that point is, but I do know, I do speak with Dr. Anna Malhasia on a regular basis. And I do know from her clinical expertise and my research that EDTA chelation works, to stop this.
Please stop.
Okay, stop sharing.
EDTH is a very special one. You take it as infusions. And this is binding up and clearing out shit out from the blood and taking those things out from the blood system. Is that correct? So we can understand this correct?
Yeah, you can. It goes into your blood system. You can. When I get my treatments done, they add phosphatidylcholine. I can't pronounce it right. So they make sure it crosses my blood-brain barrier. And Dr. Anna's treated people. She's seen their blood clotted. She's seen the nanotech in there. And after 2 treatments, she's seen a great deal of clearance. Right.
And this is this infusion, or can you take it oral?
I do the infusions. I don't recommend and talk about treatments often. This is actually a place where I do recommend working with a doctor. Dr. Anna Malhasia, she does IV treatments. I do believe there's other ways. I think there's suppositories that you can get done. But NAC-L-cysteine also works well. High doses of NAC-L-cysteine. Zeolite helps remove it binds to the graphene oxide. It binds to other metals in your body. And then it's metabolized through your liver. So these are ways to to slow it down and possibly reverse it. But I think what's most important is that people don't continue to pretend that this isn't happening, so we can get treatment. We need to get treatment. I can stop share now. We hit stop share.
That's good. We will stop the sharing.
Sorry,
Karen, this is very important. Everyone who needs more facts, more proof, more evidence, go to Karen's Substack, Karen Kingston Substack. And there you can follow her and find everything. Is that correct, Karen?
Yeah. I think the most important evidence. So that was a little bit scientific. But the most important evidence is what Pfizer submitted to the FDA. So there's and also their contract. So there's a Substack called the $3 trillion Substack: How to Destroy Pfizer in Court. That's free. There's another Substack called Intended Consequences. That's free as well. Oh, and there's another one called the Commissioner's Letter.